didn't hear me. Oh, here we go. Okay, welcome back, folks. We're gonna pick up S-239 and our work on trying to draft some markup language. We talked about, for people just joining us, we talked about who would be on the work group. And in the meantime, as is not unusual in this day and age, we received, I'm getting all the gobbledygook. We received an email from Jennifer Pullman that was talking about the composition of the group. She was listening to our discussion this morning. And she had two thoughts. One being around the medical/mental health representatives. There's a Dr. James Metz, who is a certified child abuse pediatrician in Vermont. He's also the chair of Vermont Citizens Advisory Group to DCF. So, to me, that seems like maybe we could actually ask for the chair of Vermont Citizens Advisory Group. And that would default to him. So that
in lieu of that, like pediatrician.
Yeah.
I like that.
All right. So Vermont Citizens Fair. Okay.
Citizens Advisory Board. I guess it exists. Required to get CAPTA funds.
Oh, okay.
It's one of the it's a requirement. So that there's good link there too, because then that person can keep folks on track when it comes to the CAPTA stuff.
It does appear they have co-chairs. On their webpage, it lists co-chairs, Dr. Metz and Aaron Roland Forkey.
Okay, I know Aaron.
Pediatrician chair.
The position representative, position co-chair. Yeah. I don't know if he's a pediatrician or not, but.
He is definitely a doctor.
His title is MD, Child Abuse Pediatrician.
Oh, okay.
As listed on their website.
Okay. Great. Okay, and then the other on law enforcement, she said her feedback was that maybe we should be specific about designating somebody who has experience being assigned to a special investigations unit, because those are the places that are assigned child abuse and sexual violence cases. And they're specially trained in working with children and youth. They bring a level of skill and knowledge the average law enforcement officer would not be able to offer. So what do people think about that?
Would it be in place of another one or in addition?
Well, it would be, so we talked about the Vermont Law Enforcement Advisory Board.
Okay.
But we could specify that they appoint somebody who has experience with a special investigations unit. So it wouldn't be an additional one. It would just be a special.
That makes sense. Yeah.
I think it's good feedback.
Yeah, no, that.
Did I forget, Bob? I just recopied it. Left it
That's
right.
good.
Okay. All right. Thank you, Jennifer, if you're watching now. Okay, so let's back up to the beginning of the bill. And look at the section 1, paragraph A, where it's talking about why the working group is being created, and for the purpose of examining existing statutes and the department's rules and policies regarding mandatory reporting of abuse and neglect of child. So that seems like an introductory kind of thing.
Should we add something just in light of kind of discussions around supporting, I don't know, some kind of language to that put our intent that it's not just about the,
It's not just about reporting, it's also
Yeah.
about,
Understanding what supports might be needed
needed,
to prevent challenges.
Yeah, I guess so.
yeah,
Or
we're not going
resolve.
down into, it's,
yeah,
To prevent,
There is, I mean, it,
to better support
yeah.
or alternatives to reporting, in some cases.
Well, we're going to,
Yeah.
we're going to have a,
I know,
Copy of
I know
the
it'll be
section.
put in like the charges and stuff. I
Yeah.
just didn't know if we wanted to address it at all in this kind of
I think.
formative paragraph.
Right, the potential for alternatives to
yes.
reporting.
Yeah, yeah.
I like that.
And best practices is a good intro to that because this could be included as a part of best practices.
Right, I think it would come like right after.
Right
that.
after.
Yeah. Okay. All right, so that's just the intro. And then, I think that D, provide efficient, okay, to that, okay.
The honor
All
before.
right, so, we've talked about giving them additional time and, sort of gearing up for the second session, the second, part of the biennium. And so, Dan, you had suggested a date. I can't remember exactly when it was.
Oh, I was thinking right after crossover. So like this time of year to report back, is that what you're?
So honor before, currently says January, and we know we want to give them more
Right,
time than
give them more
January
time.
2027. So,
So I was thinking like report back to the committee, like not necessarily a report, but like what's going on. And then, but in
Update.
November, a
Oh,
report.
so like a status
Like a
report.
status
report and then the recommendation.
Yeah, like, if we did something wrong in the bill, that will give us time to whatever, put different
If we
people
need
on
to
the
add more
committee
things or change. yeah.
there might not be anything, but at least,
All right, so
we
why don't
have
we
an opportunity.
I always say honor before April 1 of 2027. Get us past crossover.
Yeah.
Present
with
a
the-
status,
Final report.
status report. Okay, and then a final report and recommendations,
October.
Yeah. Enough time for
October.
drafting.
That should be enough time.
Yeah.
Because it's second half of the biennium, so it's a
Yeah.
9-year team.
Right.
Yeah.
Plus, that will also, when we have like a status report, we can at
Give
least
us time.
look at that date, that when the reports due. We'll at least
Right,
have
we can.
better idea.
adjust it then. Okay.
All right.
Are you okay? Why?
Check, I have it.
Good.
Went down
wrong pipe. I do that all the time. Always on camera.
She needs some lessons.
Okay, so what we're saying there at the bottom of page 2 is honor before April 1st, 2027 to present a status report to the House committees and Senate committees. And then a final report with recommendations would be October 1 of 2027.
Do we want to say that the status report could be in person? Like they could just come to committee and. just
Well,
give us
that's kind of what I was thinking.
Yeah, I just don't want them to think they have to
Presentation.
do a written.
Do a whole big report,
Yeah.
yeah.
Oh, that's true.
Okay,
And then,
Yeah.
so for the final report, I wonder if this is the place or when we kind of give them guidance on what we want them to actually be looking at, but I was thinking of making sure that we include like an implementation timeline. That we want an implementation timeline from them, like that should be part of what they report back to us. Here's the recommendations and this is how long it's gonna take for them to.
Be specific, yeah.
Rather than, okay, here's a,
You say report back, not for the April.
no, for the final
Yeah,
report.
right.
Yeah, because we're gonna act on their recommendations, but I think we need to know how long it would take them to actually do what they, like for DCF and all the.
Yeah,
I throw something out.
Yeah.
It'd be like, just going through and looking at a few things and then kind of hearing all the feedback, just do this together and just want to get, feedback and
Yeah.
guys to it.
Let's see.
In developing its recommendations, the working group shall prioritize issues related to clarity of statutory definitions applicable to mandatory reporters, consistency between statutory requirements and Department for Children and Families rules, guidance, and training materials. And to your point that you just made, practical implementation challenges faced by mandatory reporters in complying with existing law. And then another another note, like the working group shall avoid expanding its review into matters unrelated to mandatory reporting obligations, thresholds, or processes unless necessary to resolve an identified reporting issue. And I believe kind of that scope condensed down to everything that I've been hearing, but also keeps from kind of going outside of the realm for what the working group is asked to report upon.
So one of the questions I have, should we be specific in asking them to review sections 49, 33 VSA, section 49?
Those, what I just mentioned right there, fall
Yeah.
right into the context of,
Who would they report that?
what do you call, 4912
Here.
and 4913.
4913.
Yeah, 49,
Definitions in
Can
that.
you-
12 is the definitions.
Send that language. I'm just like sometimes when I'm seeing
Oh,
it.
absolutely,
Could you
absolutely.
email it? That would be awesome. Thank you.
Down here and then wrote it, absolutely.
Yeah, that'd be cool. Thanks.
If, with respect to, we talked about comparison to other states. I'm wondering if something along the lines of asking to compare with other states. How does Vermont compare with other states with respect to how we define what must be reported? Or our use of, we have a reasonable suspicion standard. I don't know if that's
Yeah.
utilized or if that across the country, if that causes us to report more. How we compare to other states with the volume of reports, that should be relatively easy to gather someplace and include. And I'm wondering this, whether the data supports our higher reporting, is that yielding any different or better results, if you will? Are we, preventing,
Right, exactly.
I don't know what the measurement tool is that they would have for that.
What is better result?
Yeah, well, and what is better results? And even if we just look at something numerical.
Well, I guess so we've heard testimony that, I guess I would want to be, we did hear people say that we have a higher level of reporting or a higher threshold for
Yeah.
reporting. Or maybe it's lower.
Threshold. Yeah,
I mean,
yeah. So
lower
we have a
threshold
high
for
number of
reporting.
reports.
So we have a high number of reports. So, I think that, maybe we should review or maybe we should, when we're asking them to review data, one of the things they should be looking at is the Office of Child, Youth and Family Advocates annual reports, because isn't that where, Matthew Bernstein said the data.
Yeah, there's some.
That there's data in there that he's pulled in. So, yeah, like, so I'm not sure what evidence, I get where you're going and I agree with it.
I don't know if substantiated is terminology or result that's relatively uniform across the country. And so is our number of substantiated cases any different? We have higher reporting, but do we have any higher per thousand or 100,000, whatever measurement they take? Substantiated
Rate of,
cases.
yeah.
Well, and we saw the data from DCF that the number of, whoops, we went blank, Lori. Oh, now we're back. Okay. That the number of substantiations is decreasing. Now we're blank again.
There we are.
Oh, interesting. So, I'm thinking that, I also want to, I'm trying to make sure that what we're asking them to do is going to be within the resources that they have to do it. And recognizing we're not giving them any money to do this. And recognizing we're relying on the
Or any technical
expertise.
assistant, right?
Well, I think we can say that they can have it, they can
Yeah,
have
but
the
they're not
assistance
gonna
of the
have like
department.
data analysts that would.
No, no,
you know,
no. I mean,
analyze.
they're essentially gonna have to look at information that's already been prepared,
Yeah.
essentially, I think. So if we are, gonna wait for Eric's language to come through, because, that will, back and forth, it's driving me nuts. So for right now, is number one at the top of page 3. I'm trying to figure out order, and I guess we don't need to really figure out
Well,
order. Michelle
Yeah.
can figure out the order.
They have their.
Okay, Eric just sent
Order.
it here, so
Oh, great.
it's on our email, folks.
There was one other suggestion I attached to it too, that might help with, instead of examining the existing statutes specifically.
Put in the
Yes.
two numbers, yeah.
Yeah.
It's 13 and 14 though, isn't it?
12 and 13.
No, you're right, it is 12 and
It's 12
13,
and
sorry,
13.
yeah, sorry. Yep, you're right. You were right, Eric, mark that down as a red letter day. Uh,
My wife will say it too.
okay, let's just take a moment to read what Eric wrote. Okay. Yeah, the training materials, I think, training materials is important, materials and process, yeah.
Or do you have a vision or goal as to how detailed we want to be in respect to the requests that we outline?
I think, with maybe a little wordsmithing from what Eric's got here, and then adding, I would like to be specific in saying the sections of the statute, so they know exactly what we're asking them to review, these two, 4912 and 4913. I think one of the things that we need to maybe add to this is any, recommendations. Wrote it down earlier on this. Recommendations, related to the, any potential alternatives to reporting. And I'm not using the right language, but,
You better.
trying to get at the nuances that people kept talking about. It's like, that sometimes reporting isn't the right decision. And how do we, any recommendations about how to,
When the intervention needs to happen.
when intervention is
Yeah.
more appropriate than
Yeah,
And the report.
reporting?
the way I think I saw it referenced someplace was, is our front door too narrow? We basically have one option. And should there be more than one option?
I mean, alternatives. to
Well, we don't have one
reporting,
option anymore, Act 154 created more options.
But we have one option as far as reporting.
Or is
Yes.
Or reporting.
Right.
Having
That-
any
report or not having
Yeah,
any.
yeah,
That's what I mean.
like
Reporting.
incoming, we have the one option because people are either
Report or not?
report or not, and they're always encouraged to report because
Yes.
what if?
What if? Yeah,
But this work group can work on figuring out alternatives to reporting that would help. That's the piece, like support the situation,
How about-
support the like.
any recommendations for alternatives to reporting when in the best interest of the child?
Yes.
That's a good one,
Yeah.
And Michelle can help us wordsmith.
Yeah.
Mhm.
You're good at the legislative wordsmithing.
She's probably gonna be asking Katie. They already marked up the bill, it wasn't even there, they usually do that?
And Katie will say, oh, that's okay, they do that all the time. It wouldn't surprise me if she did a fast run through of this. Lori sent her the FYI, so she knew we were gonna be having discussions, but best interest of the child.
Under the D1, is what Eric has sent, the clarity of statutory definitions applicable. Do we want to include something about sort of how does our definition vary, in what ways, or our standard vary from other states? Because what's causing, I guess I'm trying to get at what's causing the higher reporting that we see here in Vermont compared to other states.
Well, and so, should we add? So we have a number 4, so should we add a number 5? That, well, we are, remember, let's look at the current bill. Already does say, consider best practices from other states in development, others' recommendations. These are things that we can continue to keep. Does that capture what you're talking about? Or would you be more specific about something, Doug, on that number 3?
Well, maybe it's captured by best practices, but it's really more than practice. It's kind of a step back. Like, how is it set up? Like, what language are they using? And maybe that's captured by that, but if ours is couched as a reasonable suspicion standard, for example, are we an outlier?
I mean, could we say something like, reviewing or understanding the nexus for the high number, for the reason why Vermont is such an outlier and the number of, like, could they examine that?
Or could just be that, and they can figure out whether.
Maybe reviewing other state statutes and other state best practices to determine why we're such an outlier. So I would like to, I mean, if they have the capacity and they're doing a review and they have, like, it would be nice to kind of understand why are we?
Yeah.
Because it takes a lot of resources to respond to all this.
It does. Yeah, it does. I'm again trying to remember this bill doesn't have an appropriation. Trying to, I guess I'm going to say, I think that, what we ask them to do in terms of sort of what they report back to should be, limited to 5 different areas. And, I guess we can cheat and say that some of them goes under considerations as opposed to, what they report, but,
Also, to see the level of expertise that is within this committee, that's usually enough to where people do their due diligence, don't necessarily have to be directed to.
yeah.
That's what I was thinking, like, we have a lot of expertise on this work group where they can, they probably already know some of the best practices and what other states are doing, because like the doctor we were talking about earlier, I'm sure he's very plugged in to, folks from the Special Victims Unit are probably very plugged into what's happening, maybe regionally even, in New England or across the country. So I feel like that's kind of built in. It's just.
That's why I think that, the drafter for the Senate included number 2, leverage the work of the 2 groups that already exist in Vermont.
Yeah.
Don't recreate the wheel if you've got people who've already done research about this. So,
And you already got a framework with CAPTA.
right. I kind of think, Doug, that I think that the general statement about best practices includes what they're doing in response, what they're doing for, what their statutes, consist of. I kind of think it's fairly, I think it's broad enough to include that. we don't need to talk about the quorums. So for, so we've added one thing, I think, to this list of three that Eric's got.
That was like the alternatives to reporting.
Any alternatives to reporting when it's in the best interest of the child? Have we added anything else? And we're going to specify the specific sections of statute for them
Which
to
was
look at.
4912.
Yeah.
We talked a little bit about sort of the experience of the mandated reporter and whether there was a feedback loop.
Yeah.
Well, which is interesting because I think I read on this wiki. See if they do.
I was thinking in the context, if reports that are deemed unfounded, if they're utilized to adjust the training or the approach, particularly if it's multiple, there frequently certain types of things come in that are deemed unfounded.
Well, and, one of the things I picked up on from the counselor is that is that they don't know what happens. Other than apparently nothing, but it might not be nothing. They just don't know. And sometimes there are good reasons for them not to know. Bless you. And I'm just wondering if it is, I feel like, I read this someplace where they're supposed to, get back to the reporter.
Yeah, I think it might be in 49, 13, 14. I think.
Doesn't say it in 14. I have them all. Yeah. My computer. Did you get into that?
Yeah, on 13, let's see, the commissioners shall inform the person who made the report
Okay.
under subsection A. A, whether the report was accepted as a valid allegation of abuse or neglect. B, whether an assessment was conducted, and if so, whether a need for services was founded. And C, whether an investigation was conducted, and if so, whether it resulted in substantiation.
But I think that's part of the law that we changed. I mean, that's been updated, so I'm wondering if that's part that hasn't actually been fully implemented yet, I wonder. And I think he did say, he said like they don't take action or something like that. I mean, maybe they are notified and I'd have to go back and see the exact words that he used, but
It was surprising what he said.
yeah. In some, I guess, yes and no for me. It was surprising, but if their stance is the default is report, then they're gonna report a lot more things than are actually investigated, would be my guess. But
Where is that feedback?
Where is the
That
feedback?
helps
Right.
inform
right,
changes to the process.
right.
And
I mean,
how does it impact the training and other things that are like the communications with the reporters?
if you have that many that are not substantiated,
There's a problem.
that feels like that means that there is a over reporting and or the requirements to report are
Are to.
too broad.
Yeah.
And it could be a combination of both of those things.
Yeah.
Yeah.
But when I saw the data, I was actually a little surprised. And there was a whole investigation about, oh no, that's APS. Sorry, that was adult abuse. No,
Well, I wonder if there's anything applicable for.
APS was under investigation a few years back because they weren't substantiating and had more to do with workforce than actual statute and, or whether or not somebody was being accused. What were you saying, Doug? Sorry.
I was also wondering, is there something to learn from other reporting mechanisms for other populations, for elder abuse or wherever else it might exist? I don't know what may or may not be applicable across
Mhm.
populations for reporting.
Yeah, I mean, that's potential. I mean, I think it's probably more relevant to be looking at what other states are doing in this realm, which is, one of the things that they're supposed to consider. So do people have any like further sort of thoughts about what Eric sent in the addition of, we're talking about adding any alternatives to reporting when it's the best interest of the child?
Avoid expanding its review. I don't want to necessarily pen them in, particularly if we've identified them because of their expertise.
Yeah.
Which, when they sit around the table, they will bring more expertise than we do when we sit around the table, just by the nature of
Yeah.
citizen legislature. So I just worry a little bit. I don't know if maybe we ask them to bring to us in April for their April presentation to identify any areas in which they think
Areas beyond the scope.
areas beyond the scope of.
Well, I can tell you just because this is the way things work. And if you write something in law, then I can tell you that the administration will attempt to follow the letter of the law. And so they can't just come back and say, oh, we have this idea because we in discussions, this came up. Do you mind if we do this?
No. this
Yeah,
is
we could
gonna-
say,
yeah.
no, we don't mind, but the administration's gonna say, that's not what the law says. We can, of course, we can add any other, but then that is sort of precludes them. We don't want them to go too far afield. In other words, we do want them to focus the work on 4912 and 4913, and we don't want them to, they don't need to get into the process that what happens after you report. We've already done a whole bill about that. So, and there's a whole change in process about that. So, limiting to who reports and when do you report? I think those are the two questions. Who reports and when do you report? And under what circumstances? So, that's essentially what we want them to answer.
Just to follow up, like, I don't disagree with what you're saying, and then looking at like that caveat and seeing throughout my career, some of the experience involved in seeing some committees get put into place there without some of that language, there's a potential in which I can see the committee start to flare away to where they begin to look and taking up like a wholesale redesign of the investigative and service delivery responsibilities. And
Yeah.
again, whereas if you keep the scope kind of narrow, they, do the work as tasked.
All right.
Now, is this language getting rid of this D or should we just ignore lettering numbering here on Eric's suggestion?
I
Wondering about your intent
looked at it in regards to just,
or adding.
we'd be adding in, maybe placing it, on page 2 after individuals with experience, then inserting, making that D and moving the next piece down to E.
Yeah, we're not talking about getting rid of what's there.
Yeah, it's just adding.
It's adding.
It's affirming,
Adding
yeah,
positions.
yeah.
Yeah. All right, I think we have enough for feedback when we have Michelle here. And to at least kind of go through and say, all right, this is what we're looking at, enough for her to give us a revised draft for us to look at on Friday. So do people feel okay with that? For an initial stab at this markup? Okay. All right, and there's no reason why the effect can't be on passage. And we do need to add that the two members, we need to add the language about reimbursement to the two members.
Are we gonna change the well, Michelle could do it, I'm sure, just like updating the quorum and stuff.
Yeah,
Are we gonna be silent on number of meetings, just so that?
At least once a month.
Yeah.
If we're giving them extra time, we wanna make sure that they're
Using
meeting.
it.
I think I guess I wouldn't say once a month, but might wanna come up with a number of meetings.
Hopefully.
Yeah, because they might want to
Yeah.
do twice in one month and not
Yeah.
in another.
Yeah, having that
Uh-huh.
flexibility is.
And then did you capture the thing about the two people with lived experience that you said one
Oh,
was
yeah.
from?
Yes, one is appointed by
Yeah. I
the
just wanna make sure you capture that.
OCYFA and one is.
You have a lot of notes on there.
Yeah, you're wondering how am I gonna make sense of that? Well, don't count on it. It's good I got backup sitting all around the table.
I have notes as well.
Okay. All right, so, all right, let's leave this for now. We will have Michelle.
When is Michelle coming?
Michelle's coming tomorrow at 9:45. And at 9 o'clock, just, why don't we pull up JRH 9? Because we have testimony on that tomorrow at 9, and let's just review that quickly. And then I want to talk about, S206, which is not on our board yet, but I had a conversation with Chair Byron about that, and we need to start to take a look at that and decide who we want to hear from. That's the early childhood education licensure bill, which is getting some attention. Can't say downstairs, but over there, exactly over there, right across the way, that way. In House Gov Ops. So I did ask him to move the bill along.
And Chair, I have to, it's a little more about the timeline for 239. So Friday, I see there's even potential votes, but
It all depends on what we hear back from Mark and other people, yeah.
okay, yeah, just curious about
It's probably
like,
gonna be, it's probably gonna be next week.
okay, yeah, the extent of like markup that can still happen, I guess.
Oh, yeah, I just was putting it out there so that people start to see that,
Yeah,
and we have it on, we'll put it on for potential vote next
yeah,
week too.
just coming up.
Yeah. I haven't heard back from him yet,
Yeah, no, and I reached out to like two of the other people.
okay. So it'll be interesting.
It's a roll call.
Oh. 9:38. I think all sorts of problems already. Okay,
It wasn't a roll.
so, let's pull that up. Sorry. JRH 9.
Oh, it's AG.
9? It's 9, right?
Yeah. I don't understand why we have a joint resolution in our committee.
What is it you don't understand?
Well, don't they usually get read on the floor?
For bills that, some resolutions are, what do you call it? Treated as a bill.
Oh, okay.
We've had other resolutions that have been treated as a bill. So like we did one in here. I think you were here when Representative Q was here, around, public health crisis, health equity being a public health crisis. That was a resolution.
before.
Was that before you?
Yeah.
That was a resolution. And we've actually had maybe one or two we voted on that got sent to committee, and some were in committee. And, to be honest, I'm not sure what we'll end up doing with this, but, so, and it doesn't really come up when I do JRH. Is there a special way to do a bill search?
No, I just put in JRH 9 and it came right up.
It
in
came
my
up?
search bar. I put it down.
No.
I just
When
put
you
it
get drafts
down.
and amendments,
No, no
JRH.
special character.
Yeah, it's going back. RH. There we go. There we go.
There we go.
Okay. So. So this is a resolution that's asking the American Speech Language Hearing Association to reconsider its opposition to what's called rapid prompting method. And it also involves people experiencing speech challenges. And tomorrow, I think I mentioned to you, we are going to have somebody who has a speech challenge, but is able to communicate with typing. And and part of this is about the ability of this type of support being available to students in the learning process. And I think that my guess is, and we'll probably have to hear from AOE about this, but there's probably some prohibitions against or some sort of guidance that comes about using evidence-based practices for people. This would be under special education, I imagine. And doing especially related to the use of alternative communication methods for children who lack speech. And I think that there's always controversy around some of these things that are emerging or things that some people have found success with that other people feel like the scientific community does not support. And so I think that this is really one of those things. I believe that Representative Burt had a constituent who had this issue, and he was asked to, present a resolution, and then he had sent this around for others to sign on to if they were interested. So I do know that for individuals with autism or autistic-like situations around their speech and language, there have been the role of assisted typing, or some people call it facilitate communication, has been very controversial. I'll say I have seen it in action with people that I'm very clear that these are their own words and thoughts. And yet there is, a certain body out there, and it's, these professional organizations that generally don't condone the use. I think that in this case, they're trying to figure out ways for children and youth to have access to as many opportunities to develop their communication abilities as possible. My guess is this is probably standing in the way of it, but so I think, Lori, we should probably have Representative Burt in to just describe, how this came about. I don't want to make assumptions. I'm assuming it came from a constituent request, but I don't know that. So we should have him come in. Maybe we can fit him in one of since he's right across the hall. Fit him into one of our little blank areas here on our agenda. Huh? Well, then build in now. Okay, that's good. Yeah. So that's what tomorrow is about. Tomorrow morning is the beginning of testimony on that. And then we'll see where we go with this. I'm not really sure. But we'll get a start. We'll get a start on it. So people have any thoughts, or I'm going to switch to ECE now, Early Childhood Education, S206. Do people have any thoughts about the folks that they want to hear from? Okay, great. Thank you.
I guess I'm just wondering whether one of the witnesses will be able to share with us a little more about how it works and what it is, rather than strictly that it's beneficial.
Right, right.
This works for my child or whatever. It's good, but I don't,
That's what I
I
mean.
don't even know what we're talking about
I know,
yet.
that's what I want to hear from
Well,
Representative
And
Burt.
you used a different term than what's in the,
Yes, I did.
are they the same thing?
No.
Or,
They're not the same thing. It's just I would call a related.
okay,
Um,
because I'm familiar with assisted typing, but this,
Yeah.
seemed like a new concept.
It is different. The only reason I bring it up is because, these organizations had the same response to assisted typing or facilitate
did to this.
communication as they did to this. And it's helpful to understand. And we are going to have somebody from, the committee that we're asking to review tomorrow. Tomorrow, is that what you said, Lauren? Yeah, tomorrow. So that will be good. And they will be able to explain to us, Doug, exactly what it is that we're talking about. And I think, if we can hear from Representative Burt around, what was the origins of this, that would be helpful for us to understand as well. I'm suspecting it's about access and education, but I don't know that.
Interesting, and I guess I'll applaud the language of the resolution, that it's very upfront, that it's been strongly rejected
Yeah.
by all of these professionals.
Yeah. It's true. Can't,
Well, Michael Chernick is very fact-based.
That's
and
what we
doing
need.
oh, we're doing resolutions, yeah,
Yeah.
yeah. He keeps us on the straight and narrow, doesn't
Yeah.
it? Okay, so we're looking at S206. I think that, so one of the things that we need to do is, I think that what we're going to do, we don't have possession of the bill yet, but we're going to start working on it anyway. Because I think it's going to linger a little while in government operations, because they're not the policy committee, and so they're trying to get background and come up to speed. And I realized that some members of this committee weren't here, during Act 76. So we're going to need to do some of that background for people as well. And so I think we should get started on it, even though we don't have possession of it yet. So we'll get a bill walkthrough. I think Katie is on this bill. Is her name up there? Oh, it's not up there. Sorry, it won't be up there because we don't have it yet. It is Katie. Yeah, okay. So we'll get Katie to do a walkthrough of the bill. This is probably going to end up being next week, would be my guess. It is essentially setting up a whole licensure process for early childhood educators. And this bill is not without controversy. There's a controversy in the education world around referring to folks in childcare as educators. The bill, there is a whole association, VAYEC, Vermont Association of VTAE, yeah, I always get the, what did it have? VTAEYC, okay. It's the association of people who do this work belong, and they are, a goal has been for a long time to increase the professional status of people working in childcare. And one way, and not just the status, but the payment, the wages and benefits. And, I think, the goal of this organization is to do that. And they view one way to do that is through this licensure. And so are people familiar with something called the Sunrise process, Sunrise report?
Yeah.
Okay. So before making a recommendation from OPR to do such a thing, they go through a pretty extensive reporting process that does background information and determines whether some official licensure capacity by OPR is in the best interest of the public. And so they've done that process. They've done a report on this. And, I don't know if you recall, but we had a little introduction to this process at the end of last year. So we'll need to refresh our memories and we'll have to have it again, but. And so this is proposing different levels of, licensure and, it's very sort of detailed in procedural and requirements. And there's, of course, existing, professional development, requirements in licensure capacity already for childcare, and how do these things dovetail? It does involve, increasing staffing at the Office of Professional Regulation. And there is a mixture of both support and lack of support for the bill, and for the process that's laid out in the bill. So I think that, we'll have people from all sides, present testimony. I'm particularly interested if you have anybody in your communities, who is either in favor or against, early childhood education licensure of staff. Because this is going to impact the field, okay? This is going to impact our childcare providers. And so we need to hear from, both people who are in family home care providers and center-based childcare providers, and to hear their points of view about this process. I think it is something that is fairly well known, that there's this bill, because it spent a lot of time in, government ops in the Senate last year. And the Senate tried to attach it to a bill that was a GovOps bill, and we removed it because, well, one, in the Senate, it never went to Senate Health and Welfare, which is the policy committee. And the policy committee now has taken it up in the Senate, and then GovOps in the Senate took a look at it and they passed it out of the Senate, and it is now in the House. It's in GovOps. We'll take the bill after that, but so it's had quite a lot of publicity, and VT Digger has posted some articles recently about it, and there's opinion pieces about it, and so pay attention to those things, and do as much reading as you can. And literally, I mean, you all have childcare providers in your communities, and I would really appreciate if you had an opportunity to reach out to them, to invite them to testify on their thoughts about the bill, because I want to make sure that we get a variety of viewpoints about this, because it's got potentially pretty big implications. And I want to make sure that we hear from the field in particular, because those are the folks who are going to be impacted by this. And ultimately, families will be impacted by this, because it most likely will further increase the cost of childcare.
Another thing to consider is our education and professional development system. And
That exists already.
Right, and does the infrastructure exist to kind of support this transition, and what the cost associated with that might be? So kind of
What do we have
thinking about
currently? What would be
CCD,
necessary in order
Northern
to do that?
Lights, all that,
Yeah.
what exists right now, what needs to be added, what are the costs associated with that, so.
So we're going to want to make sure we hear from Northern Lights. We're going to want to. Oh, you have a list going already. Thank you. I don't need to make up my own. Thank you. So,
But Northern Lights is really the professional development system, but I feel like it needs to be broader than that. So there's a higher ed, or early ed, education consortium that might be helpful, because that kind of talks about the whole education system in Vermont and how they can support this transition. Because I think Northern Lights is a piece of it, but
Okay.
it's not the whole picture.
mhm.
So I can get.
Well, I think we want to hear from CTEs as well, because I remember Senator Westman made sure in Act 76 and in other maybe another appropriate, one of our other childcare bills, that there was specific resources that were going to CTEs for the development or continuation of early childhood certification. It is old, I know.
Pre-COVID, I think. I remember
Yeah,
that
it could be.
project. I worked
Yeah.
on that project.
Yeah. But I don't know if they're still doing it or not. I know at
It
Central
wasn't very
Vermont, they dropped it.
It
and-
wasn't very successful.
Yeah.
Yeah.
So so maybe we don't need to hear from them. I don't know if it's still, if there's anything still going there or not, or in some CTE centers and not in others. I don't know. I mean, they literally at that point in time said, well, we don't want to have programs and encourage people to go into programs when they can't make a living wage at it.
Yeah.
That was essentially
Why
their,
a lot of them were reducing that kind of program.
Yeah.
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 So if I did a front porch forum post for my constituents,
Mhm.
what would I put? That's what I need to do. Cause I
Well,
need to know.
you can put a link into the bill, which is S-206. And
Is it S-206?
yeah, you can say your
Bill.
committee is taking up the bill and whether there are any, childcare providers out there who would like to testify.
And who would they reach out to, me?
That'd be you, yes.
Okay,
Yeah,
for,
we're not having Lori respond to front porch forum.
no, that's, no, that's
Oh my
okay.
God. Yeah, no, they would reach out to you and
I'll
then,
respond.
and then you would be in contact with
Eric's
with
name.
me and Lori. Yeah, put Eric's name down.
No, I don't mind mine. I just didn't know if there's a protocol.
Yeah.
So link to the bill, if there is any. Childcare providers who would like to testify, please contact me at. I'll do that tonight.
Okay.
Thank you.
And, what else? So you have a list of people going, that's good. So I'm sure you have, BTA, YEC.
Yeah.
And, you've got DCF.
Yeah.
Is Julie Frechette stop up here?
Yes, she does. And, she is gonna be in touch with Lori and we'll get the Y in.
And I have a childcare provider in Williston, who's like a smaller, not small, but smaller than the Y,
Yeah,
center-based program. So I think we do still need a home provider.
I have a home-based provider that was when she started contacting me last year, and I said, don't worry, when we get the bill, I will be calling you, so, I will, you can add her, Sherry Rath, is her name. Oh, no, she's not Rath. James, thank you, she was a Rath.
Sherry Jane.
James, yeah,
Someone I spoke to in the fall about this who, I think for 30+ years worked in the field, Julie Messier Briganti. Is that
okay.
a name that you're familiar with?
The name sounds familiar.
I think I know Julie.
All right, I'll circle
Funny.
back to her.
God, I haven't seen her for years.
Briganti is a name I knew from my days at, Dale as well.
Yeah, big name, cultist.
Okay, and I would like to make sure that we touch base on more rural communities as well as some of our, more developed, or not more developed. My population.
I'm gonna reach out to some who are operating centers kind of in
Yeah.
private, but in rural.
Yeah,
I also wonder if we can think about like national experts that would give us the landscape across the country and data on like what Vermont is doing and how that differs from what other states are doing. So I'll do some research on who might be able to provide that.
would Near have that information?
Maybe.
I don't know.
Start with Gigi.
Yeah. Trying to figure out, is this an attempt to leave the country? Are we following other
I think
states?
to leave the country.
No.
First step.
Follow Representative Portis. Okay, so, I mean, I
Yeah.
Okay, thank you. And I think that, I didn't look to see if there's a fiscal note on this.
Oh, yeah, that would be good.
Bill status, fiscal note. Staff letter, fiscal information. Yep, there is, okay.
Oh, I can put that link too. Okay, I'll get that link too, to put with my search, with my, right up for front porch. So I gotta find all that. I got it right here. Fiscal.
1.2 million,
Oh my God.
yeah.
Okay.
And,
I'll put those
licensure and all that kind of stuff. Those are all this is gonna have to go to Ways and Means. Because there's a bunch of fees in it.
Oh, yeah.
fiscal information.
Oh, yeah. Every city. Yeah.
I got it. I just want to put that link with that so people know what we're talking about.
Okay.
So official.
So, all right, so, and we are setting up, do we have a proposed date, maybe Lori, for a, field trip to Waterbury yet?
Well, loving issues, so here's
Oh,
a
okay.
note for you, to see if maybe we can change the order.
I will talk. There's a lot of
Okay.
youth who have to be prepped.
Yeah. But,
Yeah.
Oh,
yeah, I can,
is that?
I was given 2 days, I asked her for one, she goes, yeah, the date is. But I had scheduled the entire week around that day.
I'll,
Okay.
I'll check in with my boss
All right, okay,
after this.
Yeah, and if not, I'll
Yeah.
just make it work.
all right, thanks, Lori. Okay, so, we're just, as I said yesterday, Lori has got that wand over there and, although I didn't reference your wand, I think. Don't reference the wand, okay. Anyway, so, that's what we're up to. All right, I think, I don't have anything else for this afternoon. Unless anybody else has any sort of pending stuff. I would like to touch base with Eric and Jubilee
Yeah.
on 938. And, anybody else have anything that they want to discuss while we're online? That they need to discuss?
Yes, what can I wait for?
Yeah, no, you can do constituent work.